The most effective method to prevent hospital-acquired infections is answer is hand hygiene. Which organism is commonly spread by contact transmission? MRSA. Standard precautions should be used for all patients. Which PPE should be worn first? Gown, which is an example of a disinfectant. Alcohol 70%. Surgical hand scrub should be performed before surgery. Which infection is transmitted by airborne route? Tuberculosis. The color of the biomedical waste bag for human anatomical waste is yellow. Needle recapping should be avoided. Hepatitis B vaccine is recommended for healthcare workers. The incubation period is time between exposure and symptoms. Which PPE protects the eyes? Goggles. Autoclave sterilization uses steam under pressure. Normal autoclave temperature is (121°C), which is the most common hospital-acquired infection. UTI. Which isolation is required for chickenpox? Airborne. Biomedical waste sharps are disposed of in white container. Alcohol-based hand rub should contain at least 60%. Which infection is spread by droplets? Influenza. Hand washing with soap should last at least 20 seconds. HIV is mainly transmitted through blood and body fluids, which is not a PPE. Stethoscope. The chain of infection has how many links? Sterilization destroys all microorganisms including spores. Which waste goes into the red bag? Contaminated plastic. Which disease requires contact precautions? Mr. S.A.? Which is a disinfectant for skin. Povidone iodine. Nosocomial infection means hospital-acquired infection. The best way to prevent needle stick injury is dispose immediately in sharps container. Which disease requires droplet precautions? Mumps. Biomedical waste management rules in India were updated in 2016. Which organism forms spores? Clostridium difficile. Which glove is sterile? Surgical gloves. N95 mask protects against airborne particles. Hand hygiene should be done. All of the above. Which color container is used for glass waste? Blue. Aseptic technique prevents infection, which is an antiseptic. Chlorhexidine. First action after needle stick injury. Wash with soap and water. Which disease is spread through blood? Hepatitis. Which sterilization method is used for surgical instruments? Autoclaving. Isolation room for TB should have negative pressure. The causative agent of COVID-19 is SARS-CoV-2 HIV. Which waste is disposed of in the blue container? Glass bottles and vials. Which hand hygiene method is preferred if hands are visibly dirty? Soap and water. Infection acquired within a hospital is called nosocomial. Which PPE is removed first during doffing? Gloves. Who recommends 5 moments of hand hygiene for healthcare workers? Which infection control measure breaks the chain of infection most effectively? Hand hygiene. The primary purpose of infection control is to Prevent transmission of infection. Like, share, and subscribe for more videos.